Hey there, friends. Welcome to my channel, Health Prosper. Today, we're going to talk about something that might seem a bit odd at first, but it's actually really important for your health. Have you ever noticed that you're sweating more than you think you should be? Or maybe you hardly sweat at all, even on a really hot day? Well, you're not alone. A lot of seniors come to me with these exact concerns. Let me tell you about Mrs. Johnson. She's in her 60s and loves going to her weekly book club, but lately she's been feeling really self-conscious because she's sweating so much. She's constantly blotting her forehead and changing her clothes, and it's starting to affect her enjoyment of the club. Then there's Mr. Thompson. He's in his 70s, and he's noticed that he doesn't sweat like he used to. He's worried because he knows sweating is how our bodies cool down, and he's not sure if something's wrong. These are the kinds of questions we're going to answer today. Sweating is a normal part of our body's way of regulating temperature, but when it's too much or too little, it can be a sign of something else going on. So if you've been wondering about your sweating habits, stay tuned. By the end of this video, you'll have a better understanding of what's happening in your body and what you can do about it. Before we get into the details of too much or too little sweating, let's talk about what sweating is and why our bodies do it. You see, our bodies are like amazing little factories that work hard to keep us healthy and comfortable. One of the ways they do this is by sweating. Sweating is our body's natural cooling system. When our body temperature starts to rise, whether it's because we're in a hot environment, we're exercising, or we have a fever, our sweat glands kick into action. These glands are all over our bodies, but they're especially concentrated on our palms, soles of our feet, underarms, and forehead. When we sweat, the sweat comes out onto our skin. Then, as it evaporates, it takes heat away from our bodies. It's like when you pour a little water on a really hot surface, and the water quickly dries up. The heat from the surface is used to turn the water into vapor, and in the process, the surface cools down. The same thing happens with our sweat. It helps to lower our body temperature and keep us from overheating. There are two main types of sweat glands, acrine glands and apocrine glands. Acrine glands are the ones that are most important for temperature regulation. They produce a clear, watery sweat that's mostly made up of water and a little bit of salt. Apocrine glands, on the other hand, are found in areas like our underarms and groin. They produce a thicker, milky, white sweat that contains fats and proteins. This type of sweat is more related to our body odor because when bacteria on our skin break down these substances, it creates that familiar smell. Now that we know why we sweat, let's talk about what can happen when this normal process gets a little out of whack. Causes of too much sweat. 1. Medical conditions, hyperthyroidism. One of the most common medical conditions that can cause excessive sweating is an overactive thyroid gland, or hyperthyroidism. The thyroid gland is a small, butterfly-shaped gland in your neck. It produces hormones that control your body's metabolism. When the thyroid gland is overactive, it produces too many of these hormones. This speeds up your metabolism, and your body starts to work faster and generate more heat. So you end up sweating more than usual, even when you're just sitting still. For example, Mrs. Smith came to see me. She was always feeling hot and sweaty, even in a cool room. After some tests, we found out she had hyperthyroidism. Once we started treating her condition, her sweating started to improve. 2. Diabetes. Diabetes can also be a cause of excessive sweating. High blood sugar levels over a long period of time can damage the nerves in your body, including the ones that control your sweat glands. This nerve damage can make your body's sweating response go haywire. Some people with diabetes may sweat too much, especially on their face or upper body. Others may have a condition called gustatory sweating, where they sweat while eating. Mr. Brown had diabetes, and he noticed that he would break out in a sweat every time he ate a meal. We adjusted his diabetes treatment, and that helped to reduce his sweating. 3. Menopause. Menopause is a big change that women go through as they get older. During menopause, the levels of hormones in their bodies change. This can cause hot flashes, which are sudden feelings of heat and sweating. These hot flashes can be really uncomfortable. They can happen at any time, day or night, and can last for a few minutes. Mrs. Davis was going through menopause, and she was having several hot flashes a day. She would wake up in the middle of the night soaking wet. We talked about different treatment options, like hormone replacement therapy, which can sometimes help reduce the frequency and severity of hot flashes. Medications. 1. Antidepressants. Many seniors take antidepressants to help with their mood, but some types of antidepressants, like selective serotonin reuptake inhibitors, SSRI, can have sweating as a side effect. These medications work by increasing the levels of a chemical called serotonin in the brain, but this can also affect the nervous system's control of sweating. For example, Mr. Green started taking an SSRI for his depression. A few weeks later, he noticed that he was sweating more than usual. We talked to his psychiatrist, and they adjusted his medication, which helped to reduce the sweating. 2. Blood pressure medications. Some blood pressure medications can also cause sweating. Beta blockers, for example, are often prescribed to lower blood pressure, but they can interfere with the body's normal sweating mechanism. If you're taking a blood pressure medication and you notice an increase in sweating, it's important to talk to your doctor. They may be able to switch you to a different medication or adjust the dose. Other factors. 1. Stress and anxiety. Stress and anxiety can have a big impact on how much you sweat. When you're feeling stressed or anxious, your body goes into a fight or flight mode. This triggers a release of hormones like adrenaline, which can cause your sweat glands to become more active. For example, if you're worried about a doctor's appointment or a family issue, you might notice that your palms are sweaty. Finding ways to manage stress, like meditation or deep breathing exercises, can help reduce this type of sweating. 2. Obesity. Being overweight or obese can also contribute to excessive sweating. When you have more body fat, your body has to work harder to regulate its temperature. This can lead to increased sweating. Losing weight through a healthy diet and regular exercise can sometimes help reduce sweating in people who are overweight. Causes of too little sweat. Skin conditions. 1. Psoriasis. Psoriasis is a common skin condition that can cause your skin to become thick, scaly, and itchy. It can also affect your sweat glands. The thickened skin can block the openings of the sweat glands, preventing sweat from reaching the surface of your skin. Mr. Taylor had psoriasis on his arms and legs. He noticed that the areas affected by psoriasis didn't sweat as much as the rest of his body. Treating the psoriasis can sometimes help improve sweating in these areas. 2. Eczema. Eczema is another skin condition that can cause problems with sweating. It can make your skin dry, itchy, and inflamed. The inflammation can damage the sweat glands, reducing their ability to produce sweat. If you have eczema and notice a decrease in sweating in the affected areas, it's important to work with your dermatologist to manage the eczema. Neurological problems. 1. Nerve damage. Nerve damage can occur for many reasons, such as diabetes, a spinal cord injury, or a nerve-related disease. When the nerves that control your sweat glands are damaged, they may not be able to send the right signals to the glands. This can lead to reduced sweating. For example, if you have diabetes and develop nerve damage in your feet, you may notice that your feet don't sweat as much as they used to. 2. Certain neurological disorders. Some neurological disorders, like Parkinson's disease, can also affect sweating. In Parkinson's disease, the brain's ability to control the body's functions, including sweating, can be disrupted. People with Parkinson's may experience abnormal sweating, either too much or too little. Medications. Diuretics. Diuretics are medications that are often prescribed to help your body get rid of excess fluid. They're commonly used to treat high blood pressure and heart failure. But one of the side effects of diuretics can be reduced sweating. This is because they cause your body to lose water, and if you don't have enough water, your sweat glands may not be able to produce as much sweat. If you're taking a diuretic and notice a decrease in sweating, talk to your doctor. They may be able to adjust your medication or recommend ways to stay hydrated. Related health issues. 1. Thyroid problems and sweating. As we mentioned earlier, an overactive thyroid, hyperthyroidism, can cause excessive sweating. But an underactive thyroid, hypothyroidism, can also affect sweating, although in a different way. When your thyroid gland is underactive, your metabolism slows down. This can make you feel cold and may also lead to decreased sweating. It's important to get your thyroid function checked regularly, especially if you notice any changes in your sweating patterns. A simple blood test can tell your doctor if your thyroid is working properly. 2. Diabetes and sweating. Diabetes doesn't just cause excessive sweating, it can also lead to problems with sweating in other ways. In addition to the nerve damage that can cause abnormal sweating, diabetes can also affect your body's ability to regulate blood sugar. When your blood sugar levels are too high or too low, it can trigger sweating. For example, if your blood sugar drops too low, hypoglycemia, you may start to sweat, feel shaky, and be hungry. It's crucial for people with diabetes to manage their blood sugar levels carefully to avoid these sweating-related issues. 3. Anxiety and stress. Induced sweating. Anxiety and stress are closely linked to excessive sweating. But did you know that chronic stress can also have a long-term impact on your overall health? When you're constantly stressed, it can weaken your immune system, increase your blood pressure, and even affect your sleep. And all of these things can further contribute to sweating problems. That's why it's so important to find healthy ways to manage stress, like taking up a hobby, going for a walk, or talking to a friend. What's normal versus abnormal after age 60? As we age, our bodies change, and so do our sweating patterns. It's normal for sweating to decrease a bit as we get older. Our sweat glands may not be as active as they used to be, and our bodies may not generate as much heat. But what's the difference between normal age, related changes, and something that could be a sign of a problem? Normal age-related sweating changes usually mean that you might notice a slight decrease in how much you sweat, especially during exercise. You may also find that you don't sweat as much in response to heat as you did when you were younger. But if you're sweating so much that it's interfering with your daily life, like you're constantly changing clothes or avoiding social situations because of it, that's not normal. On the other hand, if you've completely stopped sweating in certain areas of your body, or if you're not sweating at all when you should be, like on a hot day or during exercise, that's also a cause for concern. It's important to pay attention to your body and notice any significant changes in your sweating habits. When to worry. If you notice a sudden change in your sweating patterns, it's a good idea to talk to your doctor. For example, if you've always had normal sweating, but then all of a sudden you start sweating excessively or not at all, that could be a sign of an underlying medical condition. If your excessive sweating is accompanied by other symptoms like weight loss, rapid heartbeat, or trouble sleeping, it's especially important to seek medical advice. These could be signs of a more serious problem like hyperthyroidism or diabetes. Similarly, if you have reduced sweating along with symptoms like dizziness, weakness, or a high fever, don't ignore it. These could be signs of heat-related illness or other health issues. Remember, it's always better to be safe than sorry when it comes to your health. Solutions, treatments, and lifestyle advice. Treating excessive sweating. 1. Over-the-counter antiperspirants. For mild cases of excessive sweating, over-the-counter antiperspirants can be really helpful. Look for ones that contain aluminum chloride. These antiperspirants work by blocking the sweat ducts, so less sweat reaches the surface of your skin. Apply them to the areas where you sweat the most, like your underarms, palms, or feet. Make sure to follow the instructions on the label. 2. Prescription medications. If over-the-counter antiperspirants don't work, your doctor may prescribe a stronger medication. There are medications that can help reduce sweating by affecting the nervous system's control of the sweat glands. But these medications can have side effects, so your doctor will carefully consider if they're right for you. 3. Botox injections. Botox is another option for treating excessive sweating, especially in the underarms. Botox works by blocking the signals from the nerves to the sweat glands, so they produce less sweat. The effects of Botox usually last for a few months, and you'll need to get repeat injections. Treating insufficient sweating. 1. Treating the underlying cause. If your reduced sweating is caused by a skin condition like psoriasis or eczema, treating that condition can sometimes improve sweating. Your dermatologist may prescribe creams, ointments, or other treatments to help clear up the skin and restore normal sweating. 2. Staying hydrated. Since not sweating enough can increase your risk of overheating, it's crucial to stay hydrated. Drink plenty of water throughout the day, even if you're not feeling thirsty. You can also drink electrolyte-rich drinks, like sports drinks, to replace the salts and minerals that you would normally lose through sweating. 3. Avoiding heat-related risks. If you don't sweat enough, you're more at risk of heat-related illnesses. So it's important to avoid hot environments as much as possible. If you have to be outside on a hot day, wear light, breathable clothing and stay in the shade. Use a fan or air conditioner to keep cool. Lifestyle changes for healthy sweating. 1. Exercise regularly. Regular exercise can help regulate your body's temperature and improve your overall health. It can also help with sweating problems. If you sweat too much, exercise can help your body become more efficient at cooling itself down. If you don't sweat enough, gentle exercise can sometimes stimulate your sweat glands. Just make sure to start slowly and listen to your body. 2. Eat a balanced diet. Eating a balanced diet is important for your overall health, and it can also affect your sweating. Avoid foods that can trigger sweating, like spicy foods, caffeine, and alcohol. Instead, focus on eating plenty of fruits, vegetables, whole grains, and lean proteins. 3. Manage stress. As we mentioned earlier, stress can contribute to sweating problems. Find healthy ways to manage stress, like meditation, yoga, or deep breathing exercises. These can help calm your body and reduce stress-induced sweating. Well, friends, we've covered a lot today about sweating too much or too little and what it means for you as a senior. Remember, sweating is a normal part of our body's function, but when it changes, it can be a sign of something else. If you're experiencing excessive sweating or reduced sweating, don't worry. There are many possible causes, and most of them can be treated or managed. The important thing is to pay attention to your body, notice any changes, and talk to your doctor if you're concerned. I hope you found this video helpful. If you did, please give it a like and subscribe to our channel, Health Prosper. We're here to help you stay healthy and informed. And if you have any questions or experiences to share, leave a comment below. Here's to your good health. You've got this.